Hi, my name is Kyle Waldman. I'm a student of physical therapy today. I go to Methodist University. Before we get started, I also just asked to verify your name and date of birth.
Yes, Dominique Bush, March 12th, 1996.
Okay, perfect. And today, I'm just going to be asking you various questions just pertaining to reproductive organs, involving urinating, bowel movement, just some sexual function. If for any reason you do feel uncomfortable for asking or answering any of these questions, you are entitled to not ask, to not respond. Also, I just want to let you know that none of this information will leave, and I'm just gathering this information to help educate you and just give you the best care. Is that okay with you?
Yes.
Okay. So the first thing, we're just going to start it off with just questions dealing with like urination. So I just want to ask, how often do you urinate per day?
Like 3-4 times a day.
All right, perfect. Do you urinate when you first get up?
Yes.
Okay. Now, do you also urinate before you go to bed?
Yes.
Okay, awesome. And do you ever find yourself like waking up at night having to pee?
Not often.
Okay.
Maybe like once every now and then.
Okay.
But not often though.
Gotcha. So if you do have to wake up every once in a while, how many times would you say that you go to the bathroom when you're woken up at night?
Probably like once.
Okay, good. Are you able to make it to the bathroom before you urinate? Like maybe any like dribble or like leaking?
Yeah, I make it to the
Okay.
bathroom.
Perfect. How about, do you experience any like pain or like burning sensations when you're urinating?
No.
Okay, good. And then how about, do you, whenever you cough, do you ever find yourself leaking any urine?
No.
Okay. How about, so for positional changes, do you ever find yourself feeling like you have to urinate when you, let's say, positional changes like getting up from sit to stand, or like when you're jumping or anything like that?
No.
Okay, good. And like when you do urinate, does it come out in like one stream or like multiple streams?
One stream.
Okay, good. And then do you feel like you have trouble, like when you're urinating, does it feel ease, like relaxing, or do you feel like you kind of have to like push to get the urine out?
Feel ease.
Okay, good. When you do urinate, do you feel like you have fully finished, or do you feel like you still have some left over, like you feel like you still gotta urinate more?
I feel like I'm fully finished.
Okay, good. What would you say that the color of your urine is? So description of like a dark yellow, like golden yellow, almost looking like apple juice.
Mm-hmm.
And then we'll put on the opposite spectrum like a very light, as if someone diluted like a lemonade.
It's kind of diluted.
Okay, good. Have you ever urinated any blood?
No.
Okay, gotcha. Do you ever have any trouble like actually initiating urination? Sorry. Okay, and then clearly from seeing by the color of your urine, it sounds like you're properly hydrated, but I figure I would ask too, do you know how much water you're drinking per day, like cups wise or just general basis?
4 cups.
Okay, perfect. And just to give you some just education that, you do drink about half of your body weight. So just moving forward, if you just want to keep that in the back of your pocket, just to remember.
Okay.
But clearly by the color of your urine, it seems like you're properly hydrated, so you probably know that by now. So the next thing that we're going to be moving into is just like some bowel movements. Like I said before, if you feel uncomfortable asking any of these questions, you are entitled not to answer as well.
Okay.
Awesome. How frequently would you say that you are removing bowel per day?
2-3 times.
Okay, good. Do you defecate in the morning?
Yes.
Okay, how about at nighttime?
Yes.
Okay. Do you ever feel like constipated or trouble releasing bowel movements sometimes? Okay. How about any pains? Like, do you experience any pains when trying to defecate?
No.
Okay. So one thing I do want to show you, so it's just easier for me to show you a picture. So we're just trying to get a basis of like what your typical daily poop looks like. Sometimes obviously, if you eat something wrong, don't disregard that, but just the regular basis.
Okay.
So I'm just going to show you a picture of the different types of stools, and then I just want you to point, just in general, which one you typically have.
3.
Okay, perfect. All right, there's that. Do you ever see any blood in your feces? Okay. Do you ever feel like bloated or like gassy or anything?
No.
Okay. Have you ever passed gas and accidentally removed feces or maybe like a little bit?
No.
Okay, perfect. When you have to defecate, do you feel like you can actually make it to the bathroom without feeling like you're accidentally, just in layman terms, pooping your pants?
Yes.
Okay, good, good, good. Have you, when you do try to defecate, do you sit on your tippy toes or use a squatty potty?
No.
Okay, so one thing I'll just give you good education with that is, so actually having your feet on your tippy toes or raising your legs on like a squatty potty where it actually opens up, so it allows like the external sphincter to be more relaxed, it allows the pelvic floor muscles to be more relaxed to remove defecation. So one thing I would just recommend is when you have to defecate, try actually using, getting up on your tippy toes or using a squatty potty because it'll actually allow the bowel movement to remove a lot easier.
Okay.
Some other things, I just want to ask, are you eating like the proper amount of like carbs, fats, and protein?
Yes.
Okay. And then just to give you that education, just in case, you know, I figure I just have to run it with you, but make sure you're getting about 65% carbs. You got your 10 to 35% of proteins, and then 20 to 35% of fat. But it sounds like you are getting the proper nutrients, which is great to hear. Just figured I'd give you that in case. Are you also getting enough fiber in your diet?
Yes.
Okay, awesome. Getting that half kilogram per body weight. Are you taking any medications to help remove bowel movement, such as like laxatives or anything?
No.
Okay. Do you have to ever manually stimulate the area down there to remove your feces?
No.
Okay. And then just last question about bowel movement. Have you ever used any like digitization or like a splint, some type of device to help remove your feces?
No.
Okay, awesome. So the next topic we're going into is like sexual function. So, you know, I know that can be a little bit uncomfortable for some patients, and just really wanted to reiterate this one specifically that if you do feel uncomfortable, you know, you are entitled to not answer these questions.
Okay.
All right. First one, are you sexually active?
Yes.
Okay. When you do, are you performing safe acts of sex with like condoms and?
Yes.
Okay, perfect. This one's, do you perform any acts of masturbation?
Yes.
Okay. And are you able to get an erection?
Yes.
Okay. Are you able to maintain or hold that erection?
Yes.
Okay. And then are you also able to get an orgasm?
Yes.
All right, perfect. Do you have any pain when you are ejaculating?
No.
Okay, good, good, good. And then just another question, do you experience any pain when you are penetrating or deep thrusting?
No.
Okay. Is there any experience that you have felt in any type of any sexual positions?
No.
Okay. And then do you have any pain after sexual activity?
No.
Okay, perfect. So that completes my list of questions that I have with you regarding to, you know, bowel and bladder, sexual function. I just figured I'd give you some time to ask if you have any questions right now, or if I covered everything for you.
Covered everything.
Okay, perfect. Well, that completes my interview for you, and I hope you have a nice day.
All right. Thank you.